Eyewitness News presents Newsmakers, winner of the Pennsylvania Association of Broadcasting Award for Excellence in Public Affairs Programming, with your hosts, Jane Ann Bugda and Andy Mahalchik.
Hello and welcome to Newsmakers. I'm Jane Ann Bugda along with Andy Mahalchik. Opioid abuse is on the rise across the nation and in the state. And today we are joined by staff members from one of the Commonwealth's Centers of Excellence. We'll talk about the opioid epidemic and the help that is available. When we come back, I'll introduce you to our guests, and our discussion will begin when this edition of Newsmakers returns right after this. Welcome back to Newsmakers. I'm Jane Ann Bugda along with Andy Mahalchik. The opioid epidemic impacts many lives, and today we are joined by counselors from Mount Pocono Medical. They're a center of excellence, and we're going to be talking about the opioid epidemic and about the help that is available for those who are willing to take the first step. We are joined by George Marcinkevich. He is the executive director, Nicole Cowie, who is a counselor and care manager, and John Siri, who's a longtime counselor and recovery specialist. They're joining us for the first half of the show, and I want to thank you all for joining us because you really are on the first line of defense for the opioid epidemic that we are hearing and reporting about so much in the state and across the nation. And I think we want to start by talking a little bit about Mount Pocono Medical is a Center of Excellence. So tell us what that means.
So Jane, what a Center of Excellence is the Wolf administration back in the end of 2016 had put together these grant-funded programs throughout multiple different counties throughout the state of Pennsylvania. And these programs, Center of Excellences, were put together in order to help combat the opioid epidemic, to help provide services to those in need. And there are so many of those in need right now. So the Center of Excellences, they were broken down by counties. So Mount Pocono Medical, we are in Carbon, Monroe, and Pike counties. That's the county we serve. There's also Center of Excellences in Lackawanna, Luzerne County, all across Northeast PA, as well as other counties and areas throughout the state. But the Center of Excellence, what we do is we provide that case management service. We provide that education, the outreach, the assessment, in order to get people engaged in treatment. And in doing so, we make sure that the Center of Excellence they make sure that these individuals are put into the proper treatment that they need.
You know, we often talk about, who is an opioid addict? And I think, we might have in our mind's eye who we think someone who is addicted to opioids. But tell us who is an opioid addict? They come from all walks of life.
As a counselor, I've worked with folks who are in various professions: doctors, dentists, nurses, lawyers, professional people that own their own business. Addiction in general does not discriminate, and particularly opiate does not discriminate. This particular, our medication-assisted methadone is one that has carried a stigma with it from its inception, approximately 1973. And that prevents establishments from being organized and started. And in doing that, it inhibits the help that could be available to individuals. And even more than that, this misconception of it can prevent somebody from getting involved in a substance abuse situation.
On that point, John, and we talked about this before we went to air today, I remember covering a lot of the proposals to open methadone clinics across northeastern and central Pennsylvania. And I can tell you, and a lot of our community neighbors know this, it was downright divisive of the community. It was like you were asking people to give up their right arm. That's what people were afraid of it. Are we seeing any change in that tone toward a methadone clinic being put into a community? Are we seeing any more understanding what the clinics and your treatment centers, your centers do?
My response to that would be simply by us being here, by you folks inviting us so that we can make information available. At a workshop recently, somebody said the problem is hitting bottom. Well, there's one thing about hitting bottom. People don't live through that. You may not live to be able to get to that. And when I thought more about hitting bottom, it seems to me the only thing that would change that is an awareness of what you're getting involved in, so that the teenagers and young college people don't have farm parties where they're taking pills where they don't know anything about, throwing it into a bowl and having alcohol in the same situation and thinking that in some way it's okay. It's not okay, because they're really it's Russian roulette with their life.
Mm-hmm.
How do we get to where we are now with this epidemic? I mean, I don't want to see it happen overnight. You
Didn't
are the
happen
professionals.
overnight.
You have been involved in this, Nicole.
Yes.
How do we get to a point where
I
now
recently
it's
pulled
almost
up-
uncontrollable?
Recently pulled up an article from 2000 with Mount Sinai Journal, and they were concerned then with the epidemic. It wasn't referred to as an epidemic; it was referred to as a major problem. 2015, Johns Hopkins Medical School issued this. In 2015, there were 250 million prescriptions prescribed. And their message for the physicians is, you have to pay closer attention and don't overprescribe. And just as an antidote to that, I recently had some bladder surgery, and being discharged, the individual next to me with that curtain that they use, his doc was
The
there.
privacy curtain they
His
call it?
doc was there before mine, and they had a little conversation. It's not soundproof with that little curtain
Sure.
there. So the patient said, "Doc, what about my prescription?" And the doc looked at his whatever he looked at as a reference, and he said, "Well, I gave you 7, and you've been here 5 days. You still have 5 left of the Percocet. So you don't need any until you see me during the week." And he says, "By the way, they're watching us very closely." Mm-hmm. Well, I thought, well, good.
Mm-hmm.
Well, good.
Now, if someone's watching today and says, I do need help, and wants to take that first step, is there a criteria to coming to a Center for Excellence?
Yes, the criteria for someone is basically to have an opioid dependency disease. Also, co-occurring behavioral issues, like if they have any mental health, and the need to be connected to resources. That's basically what they need.
So take us through the step. Someone makes the call and they talk to one of the counselors. What happens next?
So they'll speak to a counselor, myself, the crisis worker, whoever they come in contact with first. And what we'll do is we'll get down some basic information, name, address, what's going on, what is it that they're looking for, and try to set up a way to get in contact with them. Whether it be us going out into the community, into a safe area to meet them, or them coming to us.
And Nicole, you hit a point there, coming a safe place to meet them.
Yeah.
How are clients, the folks, referred to you? How do they find out? They may hear these centers of excellence, they hear about this agency, that group, and I'm out there and I'm trying to deal with this. Can they just call you independently? Do they need a doctor's referral? Does it have to come through, again, in some cases, law enforcement?
They
How does that work?
They come to us by word of mouth, the best way. Another patient may say, I have a friend that's I'm trying to help them get help. And they come to us, and everyone in the clinic knows who we are, so they direct the call to whoever's available, and we give them the information. They either bring them in with them when they're coming in to get their treatment, and they, sit down with us and we help them. Or they call, we have the number, the advertisement, we've been going out into the community, to the other providers to let them know we're there so that they can share this information with their patients.
Are they afraid to come forward because of the stigma? Do they feel sometimes the folks with opioid addiction, they can handle it by themselves?
Sometimes they are. Sometimes they are fearful, mostly sometimes because family, think that they can handle it on their own without coming into treatment. So that fear, also just the fear of, what if I fail? you know, but when they do come and they realize that the Center of Excellence is there for support, we're not forcing you to do it. We're trying to help you find the best way to treat your addiction.
And I think even just to expand on that a little bit, it's not just the individual that can reach out to our Center of Excellence. We have family members who have reached out in the past, friends of somebody who's an addict. I mean, as Nicole said, we have a lot of people who are self-referred by patients that we already have. But at the same time too, and I think you brought up the stigma part, a lot of families out there will feel, okay, there's something going on with this individual, but they don't necessarily want to admit it because of a lot of the stuff that John touched on before, that stigma, that negative perception. So they shouldn't feel that way because we're not looking at anybody in any type of way whatsoever. I mean, personally myself, I have a family member who is in treatment, who has been affected by this opioid epidemic. So I mean, it's everybody. Like John said, it is everybody that's impacted by this. And that is why it's so important for everybody to know that there are these programs out there. And there is this outreach available. There is people that are looking to help them, and we're not going to look at you in any type of way whatsoever. We just want you to come, and we want to work with them, and we want to get them the treatment and care that they need.
And I know we talked about this a little bit, but how easy is it to become addicted to an opioid?
Well, with that,
is it instant?
opiate is one of the drugs that is taken with other drugs, which makes it more lethal. Opiate, if we look at it, statistically, is not as great in numbers. However, the morbidity connected to opiate is greater than all the others. Okay? What happens when somebody puts an opiate into their system, it goes immediately to the brain. It goes faster if they inject it. Regardless, when it gets to the brain, there's a dopamine that is secreted such that the person enjoys, has a euphoria that they've never had before. In that process, there's also a reinforcement factor that comes into play, which means they want to get that again as soon as possible. And then that starts a cycle of reinforcement. As that goes on in time, the euphoria dissipates, and then withdrawal comes in, and the need, or the what we have as a human being, the urge to survive, that opiate attraction overtakes their concern for shelter, food, or anything else. It becomes the most important aspect of their life.
So you just don't say you hit.
It's
Can
not
you become addicted with one hit, with one?
No.
Or you're gradually building up to that where you need it now, you can't live without it?
Most folks start with the Vicodin, Percocet, and that had a lot to do with the physicians overprescribing it. Now that they funneled it and controlled it, the physicians better, they go out to the street and they'll get the brick of heroin because it's cheaper, and they get a higher high from it. And while we're on the subject, fentanyl was introduced. The Drug Enforcement Agency brought that into our knowing about it in 2007. They raided a chemistry lab in Mexico, and they closed it down. But since then, others in China and Mexico have opened up, and fentanyl is 50 times more potent than heroin. And it's lethal. And then in addition to the fentanyl, there's carfentanil, which is a veterinary medication they use for elephants. It's 4,000 more times potent than heroin is.
So when you're getting addicted fast, but then how about to break the cycle of addiction? It's a long road.
Correct. And it's a road that's individual. I mean, not everybody is the same. Like John said, some people get addicted very quickly, some people get addicted over time. But with that, I mean, we need to work with these people individually. We need to work with these people as an individual. So that's where, again, that Center of Excellence team comes into play, because they're not coming into a Center of Excellence, whether it's Mount Pocono's, whether it's one in Lackawanna County, Luzerne County, wherever it is. They're going into that Center of Excellence and they are being assessed. And that assessment is then breaking down, okay, how long have you been in your addiction? What are your resources? Do you have a job? Do you not have a job? Do you have support from a family? Do you have insurance? And I think that's one of the biggest things is insurance. A lot of people think that they can't go because they don't have insurance. Well, our Center of Excellence team, one of the first things that we do is we work on you with that insurance. We work on getting you covered. So then when we can get you covered, then you don't have to pay for treatment and that stuff's covered for you. But as to go back to the individual based, it's that initial assessment that we provide, that our team provides, that allows us to determine, do you need inpatient? Do you need outpatient? Do you need intensive outpatient? What treatment do you need?
Well, we are going to take a quick break, and when we come back, we're going to continue our conversation about the Center of Excellence with our friends here from Mount Pocono Medical. You're watching Newsmakers. We have information on today's show and about other centers of excellence on pahomepage.com or under the Newsmakers link. You're watching Newsmakers. We are a proud recipient of several Pennsylvania Association Awards for Excellence in Public Affairs Programming. We'll be right back. Welcome back to Newsmakers. I'm Jane Ann Bugda along with Andy Mahalchik. And our topic today is Centers of Excellence. They're for opioid recovery. We are talking today with our friends. They're from the Mount Pocono Medical. They are a Center of Excellence in the Poconos. And we are switched out guests now. We're still joined by George Marcinkiewicz. He is the Executive Director. Amanda Bathorf is joining us right now. She's a crisis counselor. And Hector Matias, he is a certified recovery specialist. And they too are on the front line. They are crisis counselors, and you are the people who talk to the individuals who come in firsthand. You're on duty 24 hours a day, 7 days a week. These are the people who they call if someone's in need, or the numbers that you see that we have up. Tell us a little bit about what happens when you meet someone for the first time.
Well, when we meet people, usually they're either at their worst and they're kind of, at that point where they have a lot to say and they want to say it very quickly. We also meet as crisis. We hear a lot from families too that are calling for generalized information about how they can help their loved one. So we prefer to talk to the individual, but obviously if you're a family member, we're also going to help you with resources too. I won't turn anybody away. We'll try to get their name, a phone number, because sometimes a phone gets dropped. Address, insurance, look for the criteria, look if there's co-occurring diseases or anything like that. So a lot of people sometimes say, well, I don't have insurance, I don't have any funds. Well, that's not a problem, because we will find a way. There's always resources out there. And we look to see, do you have insurance? So we'll help you apply for Medicaid. Do you have private insurance? All right, will they cover it? If not, we'll try to help you get county funding. If you don't have either or won't pay for the other, or if you have Medicare or something like that, we will work with you to the best of our ability right from the get-go. Because we want to get all that information so that when you come in, you're more than ready to get engaged. And we can start off with those referrals once we figure out and determine what kind of care you would need.
Yeah, just like George said earlier, that sometimes the family members do call for their loved ones, and sometimes we need to speak to that individual. But we also know that families are affected by it too, so I call it the 2 degrees of separation. We know somebody that knows somebody that's probably been affected. So when a family member do call, we also know that they may need help as well. So although we may not give information to that family member without a consent form, we also tell them what services are out there for the families that are affected as well. So we take the whole family, we take the whole population.
And Hector, we were talking before again about stigma.
Yeah.
And I don't want to keep beating that same subject, and I can see how families, and especially the individual, you've been through recovery, it's an ongoing process.
Absolutely. Mm-hmm.
How big of a factor is the stigma factor from preventing somebody holding them back from calling you guys?
It's
Or
big.
even family from calling you guys?
It's huge. It's huge. That's one of the biggest barriers that people have, even family members. A lot of family members sometimes are just embarrassed to admit that a family member is an addiction. But yes, stigma is a big problem, and that's one of the things that we do to work to try to break down that stigma. So sometimes when I use my own life events, I let them know that it's okay. You know, I mean, it is what it is. So sometimes that's how you address it, just by admitting it and just taking hold of it.
Quick question for you, and only go into it as far as you want to.
Sure.
What prompted you, what motivated you to get help? And you're a shining example of what treatment can do and counseling can do. What motivated you, and how long of a process? It's still ongoing, but
yes.
How long of a process is it? What do you want to tell folks out there saying, I don't know if I could do that?
It's a lifelong process. I'm gonna be honest with you. This is not something that you start and then you stop. This is something that you have to keep reevaluating. This is something that you gotta consistently do, but it's doable because I understand that recovery is based on possibilities. So if I present myself as a person that's been through it, I mean, you should see the eyes, how their eyes open up when I tell them that I'm also in recovery. They look at me and say, "Oh, wow, really?" It's not that I'm better than you, it's that I just chose to do things differently, and if I could do it, you could do it.
And you give people hope. You're an inspiration.
That's what I hope to do, yes.
And do you think people minimize how big of a factor hope is? How it really is a key element in this whole thing, that there is hope, there's light at the end of the tunnel if you keep walking down that tunnel.
Right. I guess when you're in that place, in that dark place, you lose hope of everything. Everything is out the window. So we've come to understand that there's a lot of ingredients that go into addiction: financial, relationship, education, social status, all of the above. Because once a person goes through treatment and they're finished with their treatment, they still have those issues. Those issues are still there. So that's where we come in. We come in and we address those issues during and after recovery. So we don't just walk you to the door. We'll wait for you at the door, and when you leave, we still be there with you.
So you're their support system as they go on.
Absolutely.
What agencies do you work with? Other agencies?
We work with any agency that we could refer to for somebody's needs. Everybody has an individual need. Some people need more intensive mental health than somebody who's grieving. Some people need just something simple as a food pantry. Some people, need education and things like that. And we, as long as we would have a valid consent, we'll go anywhere and do anything we could to make these people's lives better. And while in treatment and after treatment, we want them to improve and keep going. And we will find a resource, or we'll talk to whoever we have to talk to. George is really good at, talking to the higher ups to see, hey, is there something we could really do and advocate for these people and our clients and families, for people who don't know how to express themselves or lack the ability from trying to get out of the addiction that they're in.
This program is basically new, like George said, and we're working, sometimes things don't work right, we just fix it. I mean, try to get around to get a good formula. George is the kind of person that he lets us go, listen guys, whatever you think we can make it work, we make it work. Along with Don, our coordinator, they give us room to explore. Like I said, there's no blueprint for it. So we're trying to create a blueprint for it, I guess.
Because if it was easy, if there was a blueprint, people would just say, take the blueprint on page one and you're set to go.
Right.
And there is none.
Right.
And something tells me that George is a very strong physically and mental advocate for those in need out there. And that's what we need out there.
Yes, absolutely.
You need a warrior.
And how are the centers funded?
So the Center of Excellence, they're funded is grant funded through the governor, through the government. And the Center of Excellence is what we do is our patients who we do get into services, they are, when they go into treatment, whatever treatment it is, they get their services paid for by Medicaid. So around here, Northeast PA, we use CCBH, which we actually do have, which is very good too, because CCBH, what they do is they have a Center of Excellence meeting for all the Center of Excellences throughout Northeast Pennsylvania, to where we all get to collaborate and we all get to talk about those blueprints. And how we can make those blueprints work and how we can reach out to people better and how we can go across the entire state and further on to help people that are going through this addiction that we have.
We have about a minute and a half left in the show, and this half hour went quickly. This show could have been 3 hours. But I do want to ask you, as you're working with someone, what does it feel like to know that you've reached someone, that you've got them there, that you've made success, that you've had a little bit of success?
Like I said, I have about 22 years in recovery, and I know that when you're first going through recovery, it should be a selfish thing, because if you're not good, you're not going to be good for nobody else. But once you reach a certain point, it should be a gift to pass it on. And when I see a person come in and, you know, they're at their lowest, and I see them like 2 weeks later, just 2 weeks makes a big difference. I see them and they say, Hector, you guys done so much for me. Words can't explain it.
I also like the immediacy as soon as you're done and they have all that, whatever they had built up inside of them when they tell you their story, and watching the relief, knowing that I'm doing the best for myself that I can and my family, my children, whoever, and it's really great.
And we want to thank you for your work. This show went
Thank
quickly.
you.
You're watching Newsmakers. Information on today's show on the Centers of Excellence in Mount Pocono Medical can be found on pahomepage.com. Thank you all for joining us.
Thank you for having us.
Thank you for having us.
Andy Mahalchik and everyone behind the scenes. I'm Jane Bugda. Thank you for making Newsmakers part of your day.